name is Bridget and I'm a hepatology clinical nurse consultant at St Vincent's Hospital in Melbourne. I work on a 18-month project, which is a nurse and peer-led hepatitis C testing and treatment van, where we're doing outreach testing, focusing mainly on people on community corrections orders. And we're using fingerstick point of care testing technology. So we get results very quickly and we get people on treatment very quickly as well.
My name's Mark Hayes. I work a few different jobs. I work as an advanced trainee in public health medicine here at the Barwon Southwest Public Health Unit currently. And before that, I was working at the Burnett Institute as part of the viral hepatitis elimination group. I also work as a general practitioner, and I've spent quite a lot of time working in Aboriginal health at community-controlled Aboriginal health services, working with several patients on their hepatitis C journey.
Well, Australia is leading the world in reaching the World Health Organisation's goal of eliminating hepatitis C as a public health threat by 2030. And this is largely because we have unrestricted access to the direct-acting antivirals that treat the virus. Since 2016, about 100,000 Australians have been treated, but there is an estimated 75,000 people still living unnecessarily with hepatitis C, and progress has now stalled. In recent years, there have been declines in both testing and treatment for hepatitis C. And in order to achieve elimination by 2030, both testing and treatment must increase. Increasing supply through pharmacies could get us back on track to eliminate hepatitis C and demonstrate how pharmacies can be central in antiviral treatment provision.
The population that's really relevant to pharmacists is people who are on opioid agonist therapy. So this population is at higher risk of having hepatitis C, and often pharmacists are seeing people on a regular basis for their opioid agonist therapy. And so pharmacists can have conversations with people about whether they've been tested for hepatitis C, and then encouraging people to be tested if they haven't. And one of the big challenges we're facing in Victoria at the moment is the number of people who are on opioid agonist therapy is larger than the number of clinicians who are prescribing that treatment. And so unfortunately, those doctors who are prescribing that treatment often have short consults. They don't have time to spend with somebody, and they're, unfortunately, because of those restrictions, often just managing the medication and don't have time to explore things like hepatitis C. And so this is where the pharmacist is a great opportunity to kind of engage these people a little bit more who might be becoming lost in terms of their hepatitis C risk.
I think it's important for healthcare workers to talk about hepatitis C like any other health issue. This can help to destigmatise hepatitis C and to engage the patient. I find it can be helpful to depersonalise the conversation, just saying, hey, we're letting everyone know that we can test and treat for hepatitis C. As a first step, pharmacists can provide critical health information and educate patients regarding direct-acting antivirals. For example, letting people know that the new treatments are nothing like the old interferon-based treatments. And pharmacists can encourage patients to speak to their GP and community health organisations about getting tested and treated for hep C. So this can now be done in both traditional venipuncture, just a normal blood test, but also some services have access to finger prick point of care testing with just a few drops of blood. Drug user organisations and hepatitis organisations exist in each state and territory around Australia, and they can also be a really good resource for healthcare workers and for patients on testing and treatment information. When discussing hepatitis C with patients, they can let them know that the direct-acting antiviral treatments can cure hepatitis C in more than 95% of individuals. They can let them know that they're very well tolerated with only mild and uncommon side effects. A course of treatment takes just 8 to 12 weeks for most people, and it's all taken orally with no injections. And the direct-acting antivirals are subsidised through the PBS, so they're very low cost to the patient. For patients as well, a cure can be confirmed just 4 weeks after taking the last tablet.
Not treating hepatitis C does have long-term outcomes. The virus is infecting the liver long-term if it's not treated, and eventually that can lead to liver failure. It also increases the risk of hepatocellular carcinoma, which is cancer of the liver. So getting treated as early as possible reduces the risk of these things developing.
It's really important that patients know that adherence to the direct-acting antivirals is crucial, and taking at least 80% of their tablets will give them the best possible chance for cure. One effective way to promote adherence can be through daily or weekly dispensing of patients on opioid replacement therapy or other sort of pickup medications. And I tend to give people practical reminders as well. Ask them to set an alarm on their phone if they're not used to taking a daily tablet, or putting a sign on the back of their door. The use of Webster packs and dosette boxes can also be really helpful here.
Patients can definitely be retreated if somebody has been treated and has not cured the virus. Most people can be treated easily through their general practitioner. However, if somebody hasn't achieved cure through treatment through their GP, then they will have to go to a specialty service such as a liver clinic or an infectious diseases clinic at a hospital. There's a slogan that I really like, which is, you can still clear while you're using gear. So you don't have to stop using injectable drugs to clear hepatitis C. If you are still doing that, nobody's going to say you can't go on treatment. You definitely can still access treatment, and we really do want people to do that because then it reduces the risk of transmission to other people in the community. It's also a good opportunity if somebody is still using injectable drugs. Their doctor can have a chat with them about if they're interested in opportunities to or ways to stop doing that. If they're not, that's okay. But also then encouraging people to use access needle and syringe programs to use clean needles and dispose of them safely all the time.